about the pelvis. Pilates is a practice. It's not workouts. Yes, I mean, you're working out and you're getting fit by doing it, but it takes so much concentration. So it's like practicing an instrument or practicing a sport or practicing meditation, practicing a skill. That's what it is. So today we talk about the pelvis. Okay, so when the pelvis is unstable or if it's not in proper alignment, then the body mechanics sort of go wayside. So either one, you can get injured, or the second is you don't see results from what you're doing, because if you're not in proper alignment, if you're not doing it properly, you're not going to see results. When a Pilates exercise is too easy, you know that somewhere a connection is missing. So I really want to get back to those connections. The pelvis is the center of our body. It's like the powerhouse. So we want to really make sure that it's correctly aligned and that we understand the other body parts that are attached to it and what's going on. Okay, so what I want you to do is lie down on your back. Notice that you have two natural curves of your spine, right behind your neck and right underneath your low back. Okay, so you want to keep those two natural curves in your spine. A good rule of thumb to keep the neck aligned is you want to keep the forehead and chin in the same level. So if my chin is higher than my forehead, I'm in extension. If my chin is jammed into my chest, the forehead is now higher than the chin, and that doesn't feel good. I'm jamming my neck into the mat. So you want to find a place where the chin and forehead are on the same plane. Okay, and usually that means your gaze is straight up, and if my eyes go down, I can see the tops of my knees. Okay, so keeping the natural curve of your low back and not jamming it into the mat, you want to try to find a neutral pelvis. So neutral pelvis is when your hip bones and your pubic bone are in the same plane. So that means the hip bones and the pubic bone are flat and parallel with the floor. Now we want to really ground it. We want to really strengthen everything around it without jamming into the mat. Because if you jam your back into the mat, what happens is that pelvis is going to roll to you. All right? If you go the other way, you're going to have too much of a curve underneath that back. So really keep it flat. And I want you to take an inhale here. And on your exhale, pull one knee to tabletop. Okay? So now, as we do that, it's also important to note, what is the thigh bone doing in the pelvis? Notice what happens when I lower and lift that leg. There's a rotation going on in my hip socket. So the femur goes into the hip like a ball socket. So there is a nice fluidity here. So if my pelvis were to roll with me as I do this, which I see a lot, well then you're jamming your back into the mat, and then it gets the back involved, and that's where back pain happens. So you want to keep that pelvis stable and learn how to work the thighs separately from the back. So if I have to hold my pelvis stable and neutral. So we're going to do a bunch of toe taps with that. So really ground it, and then picture that socket and pull up, and I'll just let it like flow, and then lower down, and then the other side. Just stabilize and pull, and you can even feel it a little bit. Just keep marching, using your exhale to lift that leg to tabletop, because that will help give you power. And just start making that connection of a stable pelvis and a moving thigh bone. So there's a lot of mobility in the hip, which is why sort of there's a lot of hip issues, back issues. Because how often do we learn stable pelvis, right? Stable pelvis and neutral. You might see some instructors that want you to go into a little bit of an imprint as you do that, and that's fine too, but you're not jamming. I teach in neutral because it's really important to get those natural curves. One more. And then lower down. So let's add some challenge to this, okay? Get that neutral pelvis, really ground the tailbone, and then pull one leg up to tabletop. And then what you're going to do is you're going to take the other leg to tabletop, but don't do it yet. Really try to keep everything pulled in tight and really focus on not moving your pelvis. Use your exhale. Ground that pelvis as you take your leg up to tabletop. You'll know when you curved in because you're going to be like jamming that back into the mat. Keep that natural curve, okay? And then lower one leg and lower one leg. Try the same thing again. Take an inhale to prepare. Exhale as you stabilize first. And then as you continue to exhale, lift one leg. Inhale, prepare. Exhale, stabilize. And as you're stabilizing, pull up. Drop down. Drop down. Now when you drop down, don't let everything go. Really try to hold that stability. Let's try with the other leg first. Take an inhale, prepare. Exhale, pull it up. And then the other leg, pull it up. Good. Drop down. Drop down. Stay stabilized. Don't shift. Exhale, lift. Lift. So we're just adding now a little bit more flow with it. And see what that feels like. When you do Pilates properly, any little movement feels like work. So this should feel like work. Lift, lift. Now hold both up there. I want you to squeeze your thighs together and hold here. Now what you're going to do is you're going to take your hands behind your head and let your elbows sort of lift a little bit so you're not hyperextending. But we're not talking about other body parts today. We're just talking pelvis. So all I want you to do is lift up your head, neck, and shoulders and see if you can keep that pelvis neutral. Try not to jam your low back into the mat. And what happens when you jam your low back into the mat? Your knees pull towards you. Okay, so find that natural curve, find the neutral pelvis, and then lower it down. Take an inhale to prepare, exhale, lift it up, but really focus on the lower body not moving, and lower down. So give me a few here. Exhale as you lift. Squeezing those thighs together, and not tilting your pelvis at all. 4 more. 4. Try not to jam the chin into your chest as well. So you're keeping that natural neck curve. 2 more. 2. Ground it, ground it, ground it. And 1, hold it here, hold, breathe. And then lower it down, drop one leg, drop one leg. Good job. All right, so now what we're going to do is we're going to turn over onto all fours. And so what I see a lot when we do planks is sort of people lose neutral pelvis totally. So let's go on all fours and notice when you're on all fours, you can really get all 4 points with equal weight. All right, so no sinking going on. Really find a strong back. Now you want to get your pelvis neutral. So if my tilt happens, this happens, right? If I tilt the other way, this happens. Okay, so I really want to try to find that flat pelvis, get it parallel with the floor. And you want to keep that pelvis parallel with the floor as you reach one leg and then reach your other leg. All right, so if my pelvis goes too high, if I tuck it too under, I've lost it. And then the emphasis of a plank is totally gone. So what I want you to do is drop down to your knees and hold it in knees. So really you want to keep that pelvis in line with the spine. And just hold there and breathe. So focus on stabilizing it, not tilting it either way. And then what you can do is you can go down to your elbows and you'll get more work. So the elbows go right underneath the shoulders. You want to get long and you want to really keep the pelvis neutral. And if you're in front of a mirror, that helps. So just get that pubic bone and hip bones in the same plane. Pull everything in, pull your shoulders down, get your neck long. You don't want to lose anything in that neck either. Strong and long. Good. And if you have the strength, this is a beginner mat Pilates series, so I'm on my knees. But if you want a little bit more challenge, you want to keep that neutral pelvis and feel how much harder it is to come up on your toes. So if I tuck, if I lower, it makes it easier. I really want to stay neutral. And I'll know when I'm neutral when I can drop my knees and keep my pelvis where it is. So wherever you are, just hold it a few more seconds. and then just drop down and push back into a little shell stretch. Okay, now what I want to do is talk about neutral pelvis on your side. Super hard because we're sort of changing now how our brain's working. So that's why Pilates is such a mind-body connection, because you're thinking about things in different planes. So let's bend your bottom leg and rest on your arm. So I don't care which side you start on. Really get yourself lined up with the back of your mat. So we're just talking pelvis today. So basically, if I lift my leg hip height, my hip bones and my pubic bone should be parallel with the wall in front of me and the wall behind me. I want to stretch that top leg long and hold it here and really find that neutral, okay? So as I lift and lower, I'm keeping everything neutral. I'm not losing it. And that's what I see a lot in the lift and lowers of the legs, is how everything sinks. But if you just focus on neutral, you'll feel the work. And you'll feel how your alignment stops you. And that's why it's important to do everything in alignment. Your alignment will always tell you how far to go. It's actually easier to do things out of alignment. So when something gets too easy, you know you're out of alignment. So let's do, I lost count. We want to do 10. And the reason why Joseph Pilates made 10, because really you only need 10 of everything when you're doing it correctly. You'll feel the work in those 10. And lower. Whenever I hear, oh yeah, I love it, but 10 reps isn't enough, you got to make a deeper connection somewhere. Okay, you just go back to the basics and keep making connections, and that's why it's a practice. So it's so fun to go back the next day and say, okay, can I make this harder? How can I make it harder? All right, so again, find that neutral. So hip bones, pubic bone, line it up, and then that's where you lift. Now you'll challenge yourself. See how high you can lift. Notice when I get higher, what happens? I start to cave in. So I can feel myself, really that's as high as I can go before it starts to collapse. We'll do 10. And then again, I'm talking neck as well. Stay long. If I look down at my legs, I'm in flexion. If I'm back here, just look straight forward. Let's do 5 more here. Stay tight in the belly and really concentrate on that pelvis, not rolling back or forward, right on top of each other. 3, 2, and 1. Good. And then lower. So now what I want you to do is just come up to a seated position, and let's talk about neutral seated, okay? So this is how you know if you need to go on a pad to elevate yourself a little bit. So let's say you're seated here and your hips are up like this and you're already in flexion in your low back. So if you look at me like this, there's a lot of people like this with tight hips that they're pulling so much on those hips that the low back starts to flex and you're here. So if I am doing a class where we're doing twisting and you're twisting right in that flexion, you're going to cause more injury than good. All right, so what you would do is you would lift yourself up on a few cushions or pad or even a chair, lift up higher, and then just that will release the hips, and then you can get into that neutral spine. Let's stretch your legs out into a V in front of you. If you find that you're pulling again on that low back, that means the hamstrings are probably pulling that spine into flexion, so just lift up. And then lift those arms forward. So sitting up tall, get that neutral pelvis. And then in a spine stretch forward, as you flex forward, you're keeping your pelvis neutral. You're not shifting it forward with you. Okay, that's a stretch. This is spine stretch forward, which is a Pilates exercise. So imagine a big beach ball in front of you. Sit up tall, keep your pelvis neutral as you flex your spine over that beach ball. Your pelvis is going to stop you. Yes, I could continue to go forward, but look what happens. I am so out of alignment. I need to shift that pelvis back, and now it's more about pulling my belly back as I roll up. So give me a few of these. If you want to straighten, I have tight hamstrings today, so I'm having a hard time keeping neutral, but I'll try with straight legs, and then roll it up. Keep flexing through those feet. Again, lift tall and round your body over. And all we're doing is concentrating on pelvis today, not rolling that pelvis forward with you. Almost like picture yourself on a wall, and as you go forward, your pelvis stays pressed into that wall. 2 more, because so often in this exercise, this is what I see, is just, oh yeah, people that are so flexible, yes, they can stretch, and they're like, but I'm not feeling anything. Because this is more of a belly exercise. It's called spine stretch forward so that you feel your back muscles because of your belly pulling back to stretch the back. And then roll it on up and then release. Okay, so that's sort of the pelvis in all directions. Hopefully it was helpful for you. What I would suggest is sort of keep watching this video all week until you really grasp that neutral pelvis so that when you move on, because we're going to add exercises along the way, when you add on, it's going to be more challenging because you're really going to have everything in alignment. And we'll do a building block series during this. Okay, so if you liked this video, please give it a like. Subscribe to this channel if you want to keep getting your workouts. And also I have a core club. It's a monthly membership club and it's full Pilates workouts. So if you're interested in getting some full Pilates workouts every day, head on over to GretchenMcCarthy.com and I'll also put a link in the description. So thanks so much for joining me and I will see you next time.